Question 1. The nurse receives report on 4 clients. Which client should the nurse assess first? A. A client 2 days post-appendectomy reporting moderate incisional pain. B. A client with chronic obstructive pulmonary disease, COPD, with an oxygen saturation of 91% on 2L nasal cannula. C. A client admitted for dehydration with a blood pressure of 90/60 mm of mercury and a heart rate of 118 bpm. D. A client with newly diagnosed type 2 diabetes awaiting discharge instructions. Answer: C. A client admitted for dehydration with a blood pressure of 90/60 mm of mercury and a heart rate of 118 bpm. This question tests the concept of prioritizing client care using the ABC, airway, breathing, circulation, framework, which guides nurses to address immediate life-threatening issues first. The key clues are the vital signs: a blood pressure of 90/60 mm of mercury, hypotension, and a heart rate of 118 bpm, tachycardia, in a client admitted for dehydration. These findings suggest the client is experiencing hypovolemic shock, indicating inadequate circulation and perfusion, which is a life-threatening emergency. Addressing this client's circulatory instability takes precedence over managing stable chronic conditions, moderate pain, or discharge teaching. When faced with multiple clients, always remember to prioritize the client with the most unstable or potentially life-threatening condition. Question 2. A client prescribed digoxin, lanoxin, 0.125 mg daily reports nausea and seeing yellow halos around lights. What is the nurse's priority action? A. Administer the next dose of digoxin and re-evaluate symptoms. B. Instruct the client to increase dietary potassium intake. C. Withhold the next dose of digoxin and notify the healthcare provider. D. Check the client's blood pressure and apical pulse. Answer: C. Withhold the next dose of digoxin and notify the healthcare provider. This question tests your knowledge of digoxin toxicity and appropriate nursing interventions. The keywords nausea and yellow halos around lights are classic signs of digoxin toxicity, a serious adverse effect. The nurse's priority action is to withhold the medication to prevent further accumulation and worsening toxicity, then immediately notify the healthcare provider for further orders, which may include obtaining a digoxin level. Simply administering the next dose or checking vital signs without addressing the toxicity signs would be inappropriate and unsafe. Always remember that any signs of medication toxicity warrant immediate intervention and notification of the healthcare provider. Question 3. The nurse is caring for a client with a new colostomy. The client is reluctant to look at the stoma and refuses to participate in care. Which nursing diagnosis is most appropriate? A. Impaired skin integrity related to fecal diversion. B. Deficient knowledge related to colostomy care. C. Disturbed body image related to presence of stoma. D. Risk for infection related to surgical procedure. Answer: C. Disturbed body image related to presence of stoma. This question assesses the nurse's ability to identify the most appropriate psychosocial nursing diagnosis based on client behavior. The key phrases "reluctant to look at the stoma" and "refuses to participate in care" are strong indicators of a client struggling to accept the changes to their body. While other diagnoses might apply to a colostomy client, disturbed body image directly addresses the emotional and psychological impact of the new ostomy on the client's self-perception. Understanding the client's emotional state is crucial for providing holistic care and promoting adaptation to the new physical reality. Always consider the psychosocial impact of significant body changes on a client's well-being. Question 4. A nurse is preparing to administer an insulin injection to a client with type 1 diabetes. Which action by the nurse requires intervention by the charge nurse? A. The nurse rotates injection sites on the client's abdomen. B. The nurse aspirates prior to injecting the insulin. C. The nurse administers the insulin at a 90-degree angle. D. The nurse uses a 28-gauge, half-an-inch needle. Answer: B. The nurse aspirates prior to injecting the insulin. This question tests your knowledge of correct subcutaneous insulin administration technique. The critical clue is aspirates prior to injecting the insulin, which is an outdated and incorrect practice for subcutaneous injections like insulin. Aspiration is not recommended because insulin is given into the subcutaneous tissue, and there are no large blood vessels in this area to aspirate from. Modern guidelines emphasize that aspiration is unnecessary and can cause more pain or tissue damage. Always follow current best practices for medication administration. For subcutaneous insulin, avoid aspirating before injection to ensure client comfort and proper delivery. Question 5. The nurse is reinforcing teaching with a client who is prescribed warfarin, Coumadin. Which food choice indicates a need for further instruction? A. Baked chicken with mashed potatoes. B. Spinach salad with grilled salmon. C. Spaghetti with meat sauce. D. Scrambled eggs with bacon. Answer: B. Spinach salad with grilled salmon. This question assesses understanding of dietary restrictions for clients on warfarin, an anticoagulant. The key concept here is the interaction between warfarin and vitamin K, which is abundant in leafy green vegetables. Spinach salad is a significant source of vitamin K, which can counteract the effects of warfarin and increase the risk of clotting, indicating the client needs further teaching. While clients on warfarin don't need to completely avoid vitamin K-rich foods, they should maintain a consistent intake rather than large, fluctuating amounts. Remind clients that consistency in vitamin K intake is more important than strict avoidance when taking warfarin. Question 6. A 6-year-old client with asthma is brought to the emergency department with severe wheezing and dyspnea. The child is restless and anxious. What is the nurse's priority intervention? A. Administer albuterol nebulizer treatment. B. Obtain a detailed history from the parents. C. Assess the child's pulse oximetry and peak expiratory flow rate. D. Provide education on asthma triggers. Answer: A. Administer albuterol nebulizer treatment. This question tests the nurse's ability to prioritize interventions in an acute pediatric respiratory emergency. The keywords severe wheezing, dyspnea, restless, and anxious indicate acute respiratory distress requiring immediate intervention to open the airways and improve breathing. Administering an albuterol nebulizer treatment is a bronchodilator that will quickly relieve bronchospasm and is the most critical initial action to stabilize the child's respiratory status. While assessment and history are important, they come after addressing the immediate threat to the child's airway and breathing. In acute respiratory distress, always prioritize interventions that improve breathing and oxygenation. Question 7. A nurse is teaching a group of expectant parents about newborn care. Which statement by a parent indicates a need for further teaching? A. I will always place my baby on their back to sleep. B. I should expect my baby to have their first bowel movement within 24 hours. C. I will give my baby a pacifier to help them sleep, even if they're exclusively breastfed. D. I can tell my baby is getting enough milk if they have 6 to 8 wet diapers a day after the first week. Answer: C. I will give my baby a pacifier to help them sleep, even if they're exclusively breastfed. This question assesses knowledge of safe sleep practices and feeding for newborns. The crucial detail is the combination of pacifier and exclusively breastfed. While pacifier use is generally recommended for SIDS prevention, current recommendations suggest delaying pacifier introduction for exclusively breastfed infants until breastfeeding is well established, usually around 3 to 4 weeks of age, to avoid nipple confusion. Offering a pacifier too early might interfere with successful breastfeeding initiation. Always ensure teaching aligns with current evidence-based guidelines, especially concerning feeding and safety. Question 8. A client with a head injury becomes increasingly restless and irritable. The nurse observes a Glasgow Coma Scale, GCS, score change from 15 to 13. What is the most appropriate nursing action? A. Continue to monitor the client every hour. B. Document the findings and reassess in 30 minutes. C. Elevate the head of the bed to 45 degrees. D. Notify the healthcare provider immediately. Answer: D. Notify the healthcare provider immediately. This question tests the nurse's ability to recognize and respond to neurological changes in a client with a head injury. The keywords increasingly restless and irritable and a GCS score change from 15 to 13 indicate a significant and concerning decline in neurological status. These changes can be early signs of increased intracranial pressure, ICP, which is a life-threatening condition requiring prompt medical evaluation. Notifying the healthcare provider immediately is crucial for timely diagnosis and intervention to prevent further neurological deterioration. Always remember that any acute change in neurological status warrants immediate reporting to the healthcare provider. Question 9. The nurse is caring for a client with a Do Not Resuscitate, DNR, order who is experiencing severe dyspnea. The client's family insists on full resuscitation. What is the nurse's ethical priority? A. Initiate full resuscitation efforts as per the family's wishes. B. Educate the family about the client's DNR order and respect the client's wishes. C. Contact the hospital's ethics committee for guidance. D. Document the family's wishes and continue comfort care. Answer: B. Educate the family about the client's DNR order and respect the client's wishes. This question explores the ethical principle of client autonomy, especially regarding end-of-life decisions. The critical clue is the Do Not Resuscitate, DNR, order, which represents the client's autonomous decision regarding medical interventions. Despite the family's distress and wishes, the nurse's primary ethical responsibility is to uphold the client's previously expressed desires, as documented in the DNR order. The nurse must gently but firmly educate the family about the order and its implications, reinforcing that the client's autonomy takes precedence. In situations involving end-of-life choices, always prioritize and uphold the client's documented wishes. Question 10. A client with severe burns is receiving opioid analgesics for pain relief. The nurse assesses the client's respiratory rate at 8 breaths/minute. What is the nurse's immediate action? A. Document the finding and administer the next dose as scheduled. B. Administer naloxone, Narcan, as prescribed. C. Increase the client's oxygen flow rate. D. Notify the healthcare provider immediately. Answer: B. Administer naloxone, Narcan, as prescribed. This question tests the nurse's ability to recognize and intervene for opioid-induced respiratory depression. A respiratory rate of 8 breaths/minute is significantly low and indicates severe respiratory depression, likely due to the opioid analgesics. Naloxone, Narcan, is an opioid antagonist that rapidly reverses the effects of opioids and is the immediate life-saving intervention. While notifying the provider is important, administering naloxone, if prescribed and available, directly addresses the acute respiratory emergency. Prioritize interventions that directly reverse life-threatening drug effects, such as administering the appropriate antagonist. Question 11. A nurse is preparing a sterile field for a dressing change. Which action would contaminate the sterile field? A. Placing sterile gloves on the edge of the sterile field. B. Touching the outer 1-inch border of the sterile field. C. Keeping the sterile field above waist level. D. donning sterile gloves before touching sterile supplies. Answer B. Touching the outer 1-inch border of the sterile field. This question evaluates the nurse's understanding of sterile technique principles. The key concept is the 1-inch border rule. The outer 1-inch (2.5 centimeters) edge of a sterile field is considered unsterile because it is often exposed to environmental contamination. Therefore, touching this border with anything that is not sterile would compromise the entire sterile field. Maintaining sterility is crucial to prevent infections, so nurses must be meticulous about respecting sterile boundaries. Always remember that the edges of a sterile field are considered contaminated, so avoid touching them with sterile items. Question 12. A client is prescribed furosemide, Lasix. Which electrolyte imbalance is the nurse most concerned about monitoring for? A. Hypernatremia. B. Hypokalemia. C. Hypercalcemia. D. Hypomagnesemia. Answer B. Hypokalemia. This question tests knowledge of the common side effects of loop diuretics like furosemide. Furosemide is a potent diuretic that works by inhibiting sodium and chloride reabsorption in the loop of Henle, leading to increased excretion of water, sodium, chloride, and importantly, potassium. Therefore, hypokalemia, or low potassium levels, is a very common and significant electrolyte imbalance to monitor for with furosemide use, as it can lead to cardiac dysrhythmias. While other electrolyte imbalances can occur, hypokalemia is the most anticipated and serious concern. Always remember that potassium-wasting diuretics like furosemide require careful monitoring of potassium levels. Question 13. The nurse is caring for a client who is NPO, nothing by mouth, for an upcoming surgical procedure. The client asks for a sip of water because they are thirsty. What is the nurse's best response? A. Just a small sip won't hurt, but don't tell anyone. B. I understand you're thirsty, but it's important not to drink anything before your surgery for your safety. C. Let me check with the surgeon to see if a small amount of water is okay. D. You can have ice chips, but no water. Answer B. I understand you're thirsty, but it's important not to drink anything before your surgery for your safety. This question tests the nurse's ability to provide therapeutic communication and adhere to client safety protocols. The keyword NPO before surgery is critical because ingesting anything, even a sip of water, increases the risk of aspiration during anesthesia, which can be life-threatening. The best response is empathetic yet firm, clearly explaining the rationale for the restriction and prioritizing client safety without making false promises or breaking rules. Always explain the why behind restrictions, especially NPO orders, to help clients understand and comply for their own safety. Question 14. A client with a new diagnosis of diabetes mellitus is receiving education on foot care. Which statement by the client indicates effective teaching? A. I should trim my toenails by rounding the corners to prevent ingrown nails. B. I will wear open-toed sandals to keep my feet cool and dry. C. I need to check my feet daily for any redness, swelling, or breaks in the skin. D. I can use a heating pad on my feet if they feel cold at night. Answer C. I need to check my feet daily for any redness, swelling, or breaks in the skin. This question assesses proper foot care knowledge for clients with diabetes, a crucial aspect of preventing complications. The key concept is that individuals with diabetes are prone to neuropathy, nerve damage, and poor circulation, making them highly susceptible to foot injuries and infections that can lead to serious complications, including amputation. Daily foot inspection for any changes like redness, swelling, or skin breakdown is essential for early detection and intervention. Trimming nails straight across, avoiding open-toed shoes, and never using heating pads, due to decreased sensation, are also important, but daily inspection is paramount. Always emphasize meticulous daily foot checks for clients with diabetes. Question 15. The nurse is assessing a client and observes a positive Trousseau's sign. Which electrolyte imbalance should the nurse suspect? A. Hypernatremia. B. Hypocalcemia. C. Hypermagnesemia. D. Hypokalemia. Answer B. Hypocalcemia. This question tests your knowledge of specific assessment findings related to electrolyte imbalances. A positive Trousseau's sign is a classic indicator of hypocalcemia, meaning low calcium levels. This sign is elicited by inflating a blood pressure cuff above systolic pressure for a few minutes, which then causes carpal spasm, flexion of the wrist and metacarpophalangeal joints, with extension of the interphalangeal joints and adduction of the thumb. This indicates increased neuromuscular irritability. Recognizing specific signs like Trousseau's helps the nurse quickly identify and address critical electrolyte imbalances. Remember that a positive Trousseau's sign points directly to low calcium. Question 16. A nurse is preparing to insert a peripheral intravenous, 4, catheter. After selecting the site, what is the next priority action? A. Apply a tourniquet above the insertion site. B. Cleanse the insertion site with an antiseptic solution. C. Don clean gloves. D. Flush the forecatheter with saline. Answer C. Don clean gloves. This question assesses the correct sequence for preparing an fore insertion. While all options are part of the process, don clean gloves is the next immediate priority after site selection. Gloves are crucial for infection control and protecting both the nurse and the client from exposure to blood and body fluids. Applying the tourniquet or cleansing the site should only occur once proper personal protective equipment, PPE, is in place. Always prioritize personal protective equipment, PPE, before handling any client fluids or beginning an invasive procedure. Question 17. The nurse is caring for a client with Clostridium difficile, C. diff, infection. Which action by the nurse is most effective in preventing the spread of infection? A. Wearing a surgical mask when entering the client's room. B. Using an alcohol-based hand sanitizer after exiting the room. C. Placing the client in a private room with contact precautions. D. Administering antibiotics as prescribed. Answer C. Placing the client in a private room with contact precautions. This question tests the most effective infection control measures for Clostridium difficile. The key to preventing C. diff spread lies in contact precautions, which includes placing the client in a private room and wearing gloves and gowns. Importantly, alcohol-based hand sanitizers are not effective against C. diff spores. Nurses must use soap and water for hand hygiene after contact. While antibiotics treat the infection, isolation and proper hand hygiene are paramount for preventing transmission. Always remember that strict contact precautions and soap and water hand washing are essential for C. diff. Question 18. A client is receiving total parenteral nutrition, TPN, via a central venous catheter. The nurse notes the TPN bag is empty, and the new bag is not yet available from the pharmacy. What is the nurse's most appropriate action? A. Discontinue the TPN infusion and flush the line with saline. B. Infuse 5% dextrose in water, D5W, at the same rate as the TPN. C. Hang a bag of normal saline until the new TPN bag arrives. D. Temporarily stop the infusion until the new TPN bag is ready. Answer B. Infuse 5% dextrose in water, D5W, at the same rate as the TPN. This question tests the nurse's understanding of managing TPN interruptions. The critical concept is preventing hypoglycemia, a rapid drop in blood sugar, which can occur if a high glucose solution like TPN is abruptly stopped. Infusing 5% dextrose in water, D5W, at the same rate provides a continuous source of glucose, preventing rebound hypoglycemia until the new TPN bag is available. Simply stopping the infusion or using normal saline would risk serious blood glucose fluctuations. Always remember to hang a dextrose solution to prevent hypoglycemia if TPN is temporarily unavailable or stopped. Question 19. The nurse is assessing a 4-year-old child admitted with dehydration. Which assessment finding is most concerning? A. Absent tears when crying. B. Capillary refill of 2 seconds. C. Dry mucous membranes. D. Urine-specific gravity of 1.030. Answer: A. Absent tears when crying. This question assesses the nurse's ability to identify critical signs of dehydration in a pediatric client. The keyword most concerning directs you to the most severe indicator. While dry mucous membranes and high urine-specific gravity, 1.030, are signs of dehydration, absent tears when crying is a late and severe sign, indicating significant fluid volume deficit in a child. A capillary refill of 2 seconds is considered normal. Always recognize that late signs of dehydration, especially in children, signify a more urgent need for intervention. Question 20. A client with a long history of alcohol abuse is admitted with abdominal pain, nausea, and vomiting. The nurse anticipates orders for which medication to prevent withdrawal symptoms? A. Naloxone, Narcan. B. Chlordiazepoxide, Librium. C. Haloperidol, Haldol. D. Thiamine, vitamin B1. Answer: B. Chlordiazepoxide, Librium. This question tests the nurse's knowledge of pharmacological interventions for alcohol withdrawal. The crucial information is long history of alcohol abuse and the need to prevent withdrawal symptoms. Benzodiazepines, such as chlordiazepoxide, Librium, are the medications of choice for preventing and treating the symptoms of alcohol withdrawal, like tremors, anxiety, seizures, by stabilizing the central nervous system. While thiamine is often given for nutritional deficiencies common in alcohol abuse, it doesn't prevent acute withdrawal symptoms directly. Always remember that benzodiazepines are key to managing alcohol withdrawal. Question 21. The nurse is caring for a client with a full-thickness burn to the arm. The client reports severe throbbing pain and the nurse observes a new white, waxy appearance to the wound with decreased sensation. What is the nurse's priority concern? A. Inadequate pain control. B. Infection of the burn wound. C. Development of compartment syndrome. D. Impaired body image. Answer: C. Development of compartment syndrome. This question assesses the nurse's ability to identify a life-threatening complication in a burn client. The keywords are severe throbbing pain, new white, waxy appearance, and decreased sensation. These findings, especially the change in appearance and sensation combined with throbbing pain, are classic signs of compartment syndrome, which results from increased pressure within a confined space, like the arm, leading to compromised circulation and potential tissue death. While pain control and infection are concerns, compartment syndrome requires immediate intervention to save the limb. Always recognize that sudden, severe pain and neurovascular changes in a limb can indicate compartment syndrome, a surgical emergency. Question 22. The nurse is administering a purified protein derivative, PPD, skin test for tuberculosis. Which action indicates correct technique? A. Injecting the solution into the subcutaneous tissue. B. Using a 25-gauge, 5/8-inch needle. C. Injecting 0.1 milliliters of PPD to form a wheal. D. Reading the test result after 72 hours. Answer: C. injecting 0.1 milliliters of PPD to form a wheal. This question tests the correct technique for administering an intradermal injection, specifically a PPD test. The key details are the volume of solution, 0.1 milliliters, the formation of a wheal, a small, raised blister-like area, and the correct route. PPD tests require an intradermal injection, meaning the solution is injected just under the top layer of skin, which typically results in the formation of a wheal. Subcutaneous injection or using incorrect needle size would be inappropriate. Always remember that for a PPD test, the goal is to create a small wheal with 0.1 milliliters of solution injected intradermally. Question 23. A 78-year-old client with dementia becomes agitated and attempts to climb out of bed. What is the nurse's initial intervention? A. Apply bilateral wrist restraints. B. Administer a sedative medication. C. Reorient the client to reality and engage in a calming activity. D. Notify the healthcare provider for a new order for chemical restraints. Answer: C. Reorient the client to reality and engage in a calming activity. This question assesses the nurse's approach to managing agitation in a client with dementia, prioritizing non-pharmacological and least restrictive interventions. The keywords agitated and attempts to climb out of bed in a client with dementia suggest confusion and potential safety risk. The initial intervention should always be to use de-escalation techniques, such as gently reorienting the client, offering comfort, or engaging them in a simple, calming activity to address the underlying cause of agitation. Restraints and sedatives are considered last resorts after less restrictive measures have failed. Always prioritize de-escalation and safety first, using the least restrictive measures possible for agitated clients. Question 24. The nurse is caring for a client experiencing an acute myocardial infarction, MI. The client reports crushing chest pain radiating to the left arm. What is the nurse's priority action after ensuring a patent airway? A. Administer morphine sulfate intravenously. B. Obtain a 12-lead electrocardiogram, ECG. C. Administer oxygen via nasal cannula. D. Prepare the client for immediate cardiac catheterization. Answer: B. Obtain a 12-lead electrocardiogram, ECG. This question tests the nurse's immediate priorities in managing an acute myocardial infarction. While all options are relevant, obtaining a 12-lead electrocardiogram, ECG, is the most critical diagnostic step after ensuring airway, breathing, and circulation. The ECG provides vital information about the location and extent of the MI, which guides subsequent treatment decisions, such as reperfusion therapy. Administering oxygen or morphine are important comfort and symptom relief measures, but the ECG is essential for immediate diagnosis and determining the path of care. Always prioritize immediate diagnostic tests that directly impact critical treatment decisions for acute cardiac events. Question 25. A client diagnosed with diverticulitis is experiencing acute abdominal pain. Which dietary instruction is most appropriate for the nurse to provide during the acute phase? A. Eat a high-fiber diet, including whole grains and raw vegetables. B. Consume a clear liquid diet to allow your bowel to rest. C. Increase your intake of red meat and dairy products. D. Avoid all fluids to prevent further bowel irritation. Answer: B. Consume a clear liquid diet to allow your bowel to rest. This question assesses knowledge of dietary management during an acute exacerbation of diverticulitis. The keyword acute phase is crucial. During an acute flare-up of diverticulitis, inflammation of diverticula in the colon, the goal is to reduce irritation and allow the bowel to rest and heal. A clear liquid diet is appropriate as it provides hydration and minimal residue. A high-fiber diet is typically recommended during remission to prevent diverticulitis, but it would exacerbate symptoms during an acute attack. Always remember that during an acute episode of diverticulitis, the bowel needs rest, and a clear liquid diet facilitates this.